Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on osteoporosis. So today's our topic of discussion is osteoporosis. Today in this lecture, what we are going to discuss about osteoporosis, why osteoporosis occur, what is the reason that the osteoporosis occur, which body part, which organ affected by osteoporosis. Osteoporosis occur more frequently in men or women, or at which age this affect more. Is there any treatment for osteoporosis? Some drugs are available or not? So all this point we are going to discuss is in this lecture for osteoporosis. Now, before we start our discussion on osteoporosis, I would like to show you some figures. And in this figures, you will see that there is a comparison between the normal healthy bone. For example, in this figure, you are seeing that normal healthy bone is shown, and this one is the osteoporotic bone. And the detail of the figure 6.17, the contrasting architecture of normal versus osteoporotic bone. So in figure A and B, we have seen the comparison of normal and osteoporotic bone, and this figure is actually a micrograph taken by scanning electron microscope. And we have seen the figure, we have observed the figure in 300x magnification of electron microscope, scanning electron microscope. Now one more figure. In this figure, again there is a comparison. On left hand side normal bone is shown, and on right hand side osteoporotic bone is shown. The detail of the figure, see figure 6.11, comparison of spongy bone tissue from a normal young adult, and B, a person with the osteoporosis. Now in this bracket, as you can read this information, see what happens in osteoporosis. So in osteoporosis, bone resorption outpaces bone formation. So we can say, in other words, we can say bone resorption is more speedy, more quickly take place than the bone formation take place. So due to that, as the bone resorption is occurring more in the bone in osteoporosis, so bone mass decreases in osteoporosis. Okay, now in this figure also, see on left hand side normal bone in vertebra, and on right hand side osteoporotic bone in vertebra are shown. Once again, normal bone, osteoporotic bone. But this figure, as we can see, this is the black and white image is shown to us, SEM 20x. So now we are starting our discussion on osteoporosis. One minute. Okay. See, osteoporosis. Okay. So see, for most of us, the phrase bone problem of the elderly brings to mind stereotype of a person with the osteoporosis. Okay. Hunch over old woman suppling behind her walker. So the meaning of this three line is that, see, when we heard the term osteoporosis, when we think about osteoporosis, So we think that the it is a problem of the elderly person, that we normally think. And the image which is created in our mind, the image is created of old woman, and the old woman is not able to walk properly, and to walk, she is taking the help of the walker. So with the help of the walker, she is slowly she is walking, because she is suffering from osteoporosis. So that is the meaning of these three lines. Okay, now what is osteoporosis? So osteoporosis refers to a group of disease. So it is not a one disease, but it is actually a group of disease in which bone resorption outpaces bone deposit. So bone resorption is taking place very quickly, very fast in comparison with the bone deposit. Now, here the composition of the matrix remain normal. In osteoporosis, what happened? The bone matrix, the composition remain the normal. It remain the same. Uh, but the bone mass decline. So there is a decrease in the bone mass in osteoporosis, and as the bone mass is declining, bones become porous. So you will find small holes. Okay, small holes are present in the bone. So that's why the bones are the porous, and the bones become very lightweight. Okay, in the osteoporosis. Now the bones become fragile. Fragile means they are easily breakable. The bones are, and they can break from something as simple as stepping out. So if a person steps out very quickly, so it is possible that he may get a fracture in the bone, or a hearty sneeze, or if the person is sneezing very heavily, so in that situation also he can break his bone, he can fracture his bone. That is the peculiarity of osteoporosis, that much fragile the bones are becoming. Okay, that much brittle the bones are in osteoporosis. Now, what is the age in which the osteoporosis occur? So, osteoporosis occur most often in post menopausal woman. So, in woman after the menopause, osteoporosis take place. Uh, See, worldwide, 1 in 3 women over 50 will experience a bone fracture due to osteoporosis. So 1 out of 50 women, they are experiencing a fracture. They come across the fracture due to osteoporosis. Now, even though osteoporosis is affecting the entire skeleton, but in our body there are specific sites that they are more prone to the attack of osteoporosis. And this common site of our body are, the compression fracture of the vertebra. This is the one place where the osteoporosis is most observed. And second place is the fracture of the neck of the femur. So neck of the femur is getting the fracture, and due to that the hip is broken down. So this is also the place where more osteoporosis is observed, is occurring in our body. Now, causes or the risk factor of the osteoporosis, why osteoporosis occur. So there are several factors responsible for osteoporosis. Let's discuss all of them one by one. See, first reason for osteoporosis to take place is the decreased sex hormone. See, in males, androgens are there, and in female, estrogens are there. Okay, so during young age in males, androgen, and during young age in female, estrogen restrain osteoclast activity. Restraint means the androgen and the estrogen, they are stopping, they are somehow they are slowing down the activity or the action of the osteoclast. And this androgen and estrogen, they promote the deposit of new bone. Okay. So now in young age, these hormones, androgen in men and estrogen in female, helping to maintain the normal bone density of the skeleton. So generally, young persons are not affected much by osteoporosis because there is a sufficient level of androgen and estrogen is present in the body. That's why. Now, estrogen secretion decreases after menopause, and the decrease in estrogen level after menopause is a strong reason for osteoporosis to occur in older women. So in older women, as the level of estrogen is going down, it is the main reason for osteoporosis to occur in older women. Then second reason is the insufficient bone stress. If the bones are not properly stressed that much, that means the bones are not given the tension or the pressure. So if the bones are not given the stress or pressure or tension, so it is also a reason for the osteoporosis to occur. Now what happen if a low body weight is there, if the person is not having a sufficient weight, body weight is low, or a person is not performing weight bearing exercise, that means a person is not going to gym, and if a person is not performing the heavyweight exercise, so it is possible that he will develop osteoporosis in his or her bones. Okay. Because if person is not performing exercise, so new bone deposit is going to hinder, is going to stop. Then a diet poor in calcium, vitamin D and protein, that is also reason for osteoporosis to occur. So in a food, in a diet, if person is not getting the sufficient amount of calcium, vitamin D and protein, so that can lead to osteoporosis in the bone. Then smoking. Okay. Smoking, for example, see in the bracket they are writing which reduces estrogen level. That means here they are talking about smoking, but they are also simultaneously talking about the reduced estrogen level. That means here they are talking about this smoking habit of females, women and girls. So if women and girls are smoking, for example, they are smoking the tobacco in the form of, let's say, a cigarette, or the bidi, or the chillum, or the hookah, in any form, if they are smoking, then what will happen? Estrogen level is going to be reduced, and there will be a reduction in calcium absorption. So to avoid osteoporosis to occur, to take place, women and girls are advised to keep away themselves from the smoking. And this is not that I'm telling, this is written in the biology reference book, okay, that the smoking should be avoided to prevent the osteoporosis. Now genetic reasons are also there for osteoporosis. So let's say grandfather is suffering from osteoporosis, so there are much more chance that his son is developing osteoporosis, and then the third generation and the fourth generation is also developing the osteoporosis. So from generation to generation, this is going on, this disease is going to be repeated. So we can say it is the heredity reason, it is the genetic reason involved in the osteoporosis. Then some hormone related condition such as the diabetes mellitus and the hyperthyroidism are also the cause for the osteoporosis. Then consumption of alcohol. So the drinking of alcohol should be avoided totally. So and alcohol means daru, sharab or madira also known as. So all these things should be avoided. Okay. Then certain medication, for example steroid and certain cancer drug, they are also responsible for osteoporosis to occur. Now, preventing and treating osteoporosis. So, osteoporosis can be prevented or at least delayed. And how we can prevent, how we can delay osteoporosis? So by minimizing the factors listed above. So all the bad habit, if we stop all this all that bad habit that we have discussed, so we can prevent ourselves from suffering from the osteoporosis. In particular, have an inadequate diet. So the balanced diet we should eat daily, so that osteoporosis we can prevent. Then get lots of load bearing exercise. That means we should perform daily, we should perform some heavy exercise. Actually we should purchase regular gym. We should purchase, rather we must purchase the gym membership, regular gym, annual gym membership we should purchase. And in the gym, let's say at least for 1.5 or 2 hours we should be doing heavy exercise with the dumbbell, barbell and squat, etc. in the gym, so that can prevent and delay the osteoporosis. Then osteoporosis is treated with weight bearing exercise. So again, heavy exercise. If the person is performing heavy exercises with the weight, then it can prevent and delay the osteoporosis. And if the person is taking calcium and vitamin D in the food properly, then osteoporosis can be prevented. Then to treat the osteoporosis, there are different categories of drugs are available in the market, and this drug include biphosphonates and rank L inhibitor, denosumab. So these are the drugs which can be used for the treatment of the osteoporosis. Now both these drug, biphosphonate and rank L inhibitor, denosumab, both these drugs, they inhibit the action or the activity of osteoclast, and they promote the bone sparing properties. Okay, bone deposition, they promote these two drugs. Okay, so this is about the treatment of osteoporosis, prevention of osteoporosis. Now moving forward. So once again, osteoporosis. See, osteoporosis, the most common bone disease is osteoporosis, and osteoporosis is literally meaning porous bone. So that means small holes are there in the bone. And in this osteoporosis, there is a severe loss of bone density. Okay, so bone become less denser. Osteoporosis affect especially the spongy bone, because spongy bones are metabolically active, so they are more susceptible to osteoporosis attack. uh, and dense bone, they are not affected much by osteoporosis, because see, there is a less surface available in dense bone for osteoclast activity, whereas in spongy bone the osteoclasts are having greater surface. They are so on in spongy bone, osteoclasts are getting large surfaces to act on. Okay, so it is very easy for osteoclasts to attack on spongy bone to osteoporosis to occur. So, due to the osteoporosis, what happened? The bones become brittle. Brittle means easily breakable and highly subject to pathological fracture from stress, such as slight sitting down too quickly. So the bones are very fragile, they are very breakable, they are very brittle, and if the person who is suffering from osteoporosis, if the person is sitting very quickly, then also there is a chance that the bones are going to get the fracture or the bones are going to broken down. Now, fractures occur especially in the hip, in the wrist, and the vertebral column. Now, as the vertebra lost bone due to osteoporosis, so the vertebra become compressible and the spine is often deformed. That means the shape of the backbone or the spine is changed. And this condition is known as kyphosis. Kyphosis, also known as widow's hump. So in the figure, let me show you this. See over here in this figure, as you can see, left hand side figure A. Okay, so in this figure, see spinal osteoporosis they are showing. So see in figure A, spongy bone in the body of a vertebra in a good health. Okay, so vertebra body bone they are showing spongy bone of the vertebra, and on the right hand side, for example, this in this figure they are showing the osteoporosis right hand side. Whereas the figure B, for example, in this figure, what they are showing, so X-ray of lumbar vertebra they are showing, and as you can see, the lumbar vertebra they are severely damaged by osteoporosis. Okay, so spine is deformed. Now in figure C, as you can see, old age woman we are looking at, and this woman is suffering from kyphosis due to the compression of the thoracic vertebra. So as you can see, the back is bent. Okay, this is what happened with the severe kyphosis, and kyphosis the compression of thoracic vertebra. Okay, now in osteoporosis, hip fractures are especially serious. See, each year about 2,75,000 elderly American fracture their hip due to osteoporosis, and out of one person is going to die within a year because the complications that are formed after the osteoporosis, complications such as pneumonia and the thrombosis. So osteoporosis patient, within a year they suffer from the pneumonia and the thrombosis, so that's why they are going to die within a year. Now, osteoporosis is affecting both the sexes. That means men and women both are affected by osteoporosis at all ages, from adolescence to old age. Now, generally, in women post-menopausal, that means after menopause, uh, uh, the women are at a high risk to develop the osteoporosis. Now, in contrast to men and black woman, the white woman has less bone density. See, a white woman begin losing it earlier, the density of the bone, as young as she is 35 year of age. So at the age of 35, the osteoporosis begins in some white woman, and this osteoporosis spreads very rapidly in her skeletal system. And in white woman, by the age of 70, average white woman loses 30% of her bone mass. Now, until menopause, estrogen maintain bone density. So in young woman, enough amount, proper amount of estrogen is secreted, is produced, so bone density is maintained. But what happen at old age, after menopause, osteoclast activity are going to start. So this osteoclast, they reduces the bone density, and they also reduces the bone deposition. So that's why the bone mass is decreasing, the bone become porous, and the woman suffer from osteoporosis. Now now at menopause, once the menstrual cycle stops in woman, ovaries cease. That means ovary decrease. Ovary cease means ovary decrease in size, the ovary stop ovulation, and ovaries are also decreasing the secretion of estrogen. So now in old age woman, osteoclast activity begin, and this osteoclast activity outpace bone deposition by osteoblasts. So osteoblasts, we know they are involved in bone deposition, but this osteoclast cell, once they are activated, they just they thus not allowing the osteoblast to deposit the bone properly. Now, see, when we discuss about the black woman, so in black woman, what happened? The bone density is very good, and that's why after menopause, the black woman, they are not susceptible to osteoporosis to take place, because their bones are very dense. That's why. Okay, so they are not affected much by osteoporosis. Now, see, about 20% of osteoporosis patients are men. Now, in case of men, what happened? The testis and adrenal gland, they secrete enough estrogen in men, and this secretion is continue even in old age. So there is a sufficient amount of estrogen level is present in men body, because testis and adrenal gland even in old age they are secreting the estrogen, and due to that osteoclast activity is not activated, and osteoblast activity is continued. So bone deposition is taking place, bone density is maintained in men at all ages. Now, other than the age, race, and sex, some other risk factors for osteoporosis include smoking, diabetes mellitus, poor diet, and inadequate weight-bearing exercise. All this point we have already discussed. Now, osteoporosis is surprisingly common among young female runners. Okay, so you will surprise that the young female runners, dancers, and gymnasts, they suffer from osteoporosis more. The reason is, see, all these females are like they are athletic body they are having, so their body fat is very low. Okay, and as there is a low body fat, so very soon they stop ovulating, and as the ovulation is stopping, so ovarian estrogen secretion is also very low. So they quickly they suffer from osteoporosis attack on their bones, because osteoclast activity is activated. Now, see, in early long-term space flight, astronaut develop osteoporosis. So, in the space shuttle and in the space flight, astronaut who are going for their research in the space, they are also developing osteoporosis. The reason is microgravity. So in the space, you can understand there is a very less gravity, so their bones are not getting the enough stress. Bones are not getting the enough stress, so due to that the astronaut they develop the osteoporosis. Now, to avoid this, nowadays exercise equipment, so they in their space shuttle and their space station, nowadays exercise equipment are also installed in the space shuttle and the station, so that the astronaut they can perform their weight bearing exercise in the space also, and they can avoid the attack of osteoporosis into their bones. Now, here some tests for osteoporosis are given. How to diagnose osteoporosis. So, if you are interested, you can read this information, and this is the last paragraph. So, you can go through this paragraph also. So, with this, we have completed our discussion on osteoporosis. I hope you have enjoyed this presentation lecture on osteoporosis, and I also hope that this presentation lecture will be helpful in your exam preparation and also in your studies. My name is Manish Kosti sir. I am from Ahmedabad, India. Bye bye. Namaste.